Welcome to the first ever YouTube video from the CTAD Clinic. CTAD stands for Complex Trauma and Dissociation. That will give you an understanding of where my videos are going to come from, and that's going to be the focus of pretty much all the work that I put on here. My name is Dr. Mike Lloyd. I'm a Consultant Clinical Psychologist. I can explain exactly what that is later on, possibly in another video, and the Director of the CTAD Clinic. I have spent 20 odd years working in clinical psychology and the last 10 specialising in Dissociative Identity Disorder, also known as DID or DID. When I say specialising, I mean I've spent 10 years working with people in the therapy room with DID. I've done some publications on my own and with other people, and there's some really interesting stuff out there if you would like to take a look. I'll talk about some of those things as I go along. I'm linked to an organisation called First Person Plural, which is the UK's foremost patient or user-led organisation for dissociation, especially DID, and I got awarded a lifetime membership award by them, which I'm really proud of. So thanks to all the guys at FPP. What I'm going to be doing in these videos is helping people understand from the clinical perspective what DID and general complex trauma and dissociation is all about. Might start from looking at things like what's the difference between PTSD and complex trauma, how does dissociation arrive in a person, why is it there, what's the purpose of it, is it a mental illness or is it a coping strategy, is it a defense system or is it something that really makes people's lives much worse. So we'll look at all of those sort of things as we go along. I'm going to use reflections from therapy to actually talk about my experience in the therapy room. I'm not going to talk about individual client experience. So because obviously for confidentiality and fairness and ethics, I'm not going to be using case example material from people that I've worked with. I think that would be a bit unfair on them. But I'm going to be talking in much more general terms about how I understand therapy to work in, how I understand dissociation to work in the therapy room, how I observe it, how it's worked with. I've got lots of information about ways of managing dissociation, how you assess, how you diagnose, how you treat. All of these things are really important. We'll look at how alters form and how they operate and what can be done to help them, what can be done to build internal organisation within the DID system. Well, pretty much anything that comes to mind. There's a comment section at the end of this video, so if you'd like to put some questions down, I'm more than happy to see about putting those into future videos. I'm not going to get into individual client information, so please don't post a lot of detail about your own personal background, because I'm not going to be able to offer individual consultation or clinical information on that basis. We'll try and keep things really general. There is going to be a focus on DID. As I said, that's my specialist field, and I think that that's what really is needed. There's a lot of misinformation about what it is. A lot of clinicians, a lot of academics don't really understand everything about it. So I will do my best to try and help educate and inform about the process of complex trauma and dissociation. The video then is aimed at professionals and people with complex trauma and dissociation and DID, but not just for those folks. I think it should be used for anybody that has an interest. It could be somebody that's watched a movie or a TV show or read a book about it and is just interested in finding out exactly what it is. They might know somebody who dissociates, they might know someone who has mental health problems, and it might help them really understand exactly what's going on. I'll look at some of the specifics of assessment and how we actually diagnose and the fairness of a diagnose. I'll look at the word disorder in the dissociative identity disorder and try and understand exactly what is meant by that sense of the word, because a lot of people have difficulties thinking that they're disordered, and one of the great things about DID is that it might not really be a disorder as such. So that will be an interesting conversation to have. Anyway, I hope that pretty much covers what I want to get through in this introduction section, and if there are any questions you'd like to have, please put them in the comments below and we'll see what comes up and in my next video. we'll start, see where it takes us. Okay, so thanks very much for listening and take great care.